films and books portray the psychopath as a serial killer or stalker. However, the question is to what extent these images correspond to reality. Today I am discussing the topic of psychopathy from a psychiatric and neuroscience perspective. I will try to answer the question about whether the darkest psychopaths can change. Or is there no other option than to lock them up for life? Besides, I will explain if they can experience feelings of fear and if their psychopathy is hereditary. I'm a healthcare psychologist and therapist, and I make videos on psychology and mental health topics. The term psychopathy is universal, although it is no longer listed literally in the DSM, the so-called Bible of Psychiatry. It was replaced by antisocial personality disorder. But in films, books, and also in science, the term is still widely used. The German psychiatrist Koch first used the term in 1888 to distinguish it from neurological disorders. In the 1970s, a checklist came out and is still used in forensic psychiatry. High scores on this list indicate a high degree of impulsivity, aggression, criminal behavior, a structural lack of empathy, and kinship. Once out of prison, psychopaths are 3 times more likely to commit another violent crime within a year than ex-convicts who score low on the psychopathy scale. According to the latest research, psychopathy involves a limited ability to feel fear and anxiety, a lack of empathy, irresponsibility, lack of remorse or guilt, and a tendency to exploit, manipulate, and take advantage of others. Psychopaths are generally self-centered, impulsive, relentless, and unable to maintain stable emotional relationships. Psychopaths exist across cultures and ethnic groups, and at an estimated frequency of about 1% of the population for males and 0.3 to 0.7% for females. But we can also have all these qualities to some extent. Psychopathy is a dimension, not a category. A droplet of psychopathy isn't always bad. Some traits are helpful in becoming successful in business, politics, the army, or even the entertainment industry. These are sectors where you are expected to take risks, to be confident, relentless, and goal-oriented, and to make bold choices. Those who are immune to fear, stress, depression, and guilt are also able to keep calm in very stressful or frightening situations. There are several theories about psychopathy. The first theory explains insensitive and antisocial behavior of psychopaths by lack of fear and concern. A second theory sees psychopathy as a syndrome consisting of disinhibition, daring, and meanness. According to the third theory, psychopaths have an attention deficit, which results in a defective processing of information, including stimuli of fear and sadness. You may be wondering if every psychopath is a broken human being who has ever been deeply damaged emotionally. It's a difficult question. There are big differences between psychopaths. Both genetic factors and brain functioning play a role, but environmental factors can also play a role, such as child abuse or other traumatic life experience at a young age. Research has shown that signs of psychopathy can be detected as early as 8-year-old children. In 2009, a model of psychopathy was developed. This model distinguished three factors: boldness, lack of control, and meanness. The factors are largely independent of each other and can differ between psychopaths. For example, some psychopaths score high on boldness, while the others score high on meanness and lack of control. Each of these characteristics has a genetic component. This is especially true for inhibition, in which 60 to 80% of the trait can be explained by the genes. The rest represents the influence of environmental factors. It has been repeatedly proven that the prefrontal cortex plays a big role in lack of control. High score means someone is bad at tasks that require planning and tasks that require a lot of attention. The ability to effectively process and respond to a stimulus is somewhat slow in psychopaths than in other people. The boldness trait is associated with abnormal functioning of the amygdala and the fear processing system in the brain. They play a role in responses to threats from the environment. People with a lot of boldness react much less or not at all to scary images. If the person does not or barely respond to someone else's fear, this may indicate a relatively strong meanness trait. This trait often has to do with sensitivity and the ability to connect with others. This ability is underdeveloped by psychopaths. It was also recently discovered that the reward center in the brain is activated more strongly in psychopaths than in people without psychopathic traits. The finding is consistent with the idea that psychopaths are primarily focused on reward and personal gain. Psychopathy is not so much about a lack of empathy, but about a lack of attention. The lack of concern for the welfare of others can in part be explained by this attention deficiency. In general, psychopaths see other people as objects to be manipulated. They are not interested in their feelings and their rights. Psychopaths will never plead guilty either. They always look for reasons to justify themselves or to try to manipulate others into believing that everything is their fault. Psychopaths recognize the emotions of others, but do not feel them. Psychopaths are able to process emotions and put themselves in the shoes of other person if they specifically focus their attention on them. Only psychopaths have no intrinsic interest in the welfare of others, and they have no aversion to evil. This lack of empathy explains in large part their pronounced indifference to social and moral norms. Psychopaths view the generosity and goodwill of others as stupidity, which they can skillfully exploit. In addition, psychopaths do not anticipate the consequences of their actions. If they want something immediately, they will do it, regardless of the consequences. When confronted with someone who is suffering or in need of help, psychopaths exhibit weaker activity in the brain region that plays an important role in decision-making. If psychopaths had to make a choice, it would leave them unable to determine whether that choice is good or bad for someone else. These results confirm that psychopaths have trouble experiencing what others feel, even though they recognize emotions when they pay attention to them. Psychopaths' brains also seem to give greater weight to immediate rewards, while overlooking the consequences of potentially dangerous or immoral actions. so they value an immediate reward more and overestimate its immediate benefits. Psychopaths are not disoriented and not disconnected from reality. They do not suffer from the delusions, hallucinations, and subjective anxiety that we see in most mental disorders, and they don't have psychosis. They are rational, clear, and aware of what they are doing and why they are doing it. Psychopaths do feel fear and pain and can also see it in others, but they don't care. When we look at Hannibal Lecter from the movie The Cannibal, he is extremely manipulative and does not have an ounce of guilt. But his violence is not due to his psychopathic qualities. He also suffers from sadism. Yet, the exaggerated images of psychopaths in the films are far from reality. Not all psychopaths are serial killers, and most criminals are not psychopaths. Most serial killers commit crimes out of a desire for sexual dominance. When psychopathy, sadism, and sexual dysfunction coexist in one person, it's a dangerous combo. Fortunately, it's very rare. In the past, it was believed that psychopaths cannot change and that therapy can even be counterproductive. The already quite manipulative psychopath would use the therapeutic contact to become even more cunning and gain insight into how the psyche of normal people works, and then abuse them again. A psychopath remains a psychopath was the motto for a long time. Today, the opinions of psychiatrists and psychologists are somewhat divided. Often, there is alcohol and drug abuse in convicted psychopaths, which is associated with poor impulse control. And this is difficult to change, but change is not completely impossible. Professionals working in forensic care see that some psychopaths soften with age. We now know from a number of studies that people with a personality disorder can change, and a number of therapies seem to work also for psychopaths. The attachment relationship, the bond you developed as a child with your parents, is often seriously disrupted in psychopaths. They are very distrustful. They dominate, manipulate, attack, or even try to destroy someone. But sometimes it is possible during the therapy to make contact with their emotional vulnerability. Research shows that sometimes psychopaths are up for treatment. Schema therapy can be effective, but cognitive behavioral therapy also works. However, change is not the same as healing. In fact, we can only talk about the risk of recidivism. This risk diminishes over time. In this respect, we can compare psychopathy with cancer. After a treatment, there is no longer any cancer in the body. The longer you don't have cancer, the less likely it is to come back. But we can never say that someone is completely cured. That's all for today. I hope you enjoyed this video. If you did, give it a thumbs up. It really helps the channel a lot. Don't forget to hit that subscribe button and the notification bell before you go. Thank you very much for watching. See you next time.